Hi, everybody. I'm Robert F. Kennedy Jr., your HHS Secretary, and I'm here today with NIH Director Dr. Jay Bhattacharya and FDA Commissioner Dr. Marty Makary. I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
Well, that's great news. I mean, I think so. I don't know why anyone would take that poison, but I'm happy. I bet Jennifer's happy. Joining me now, Jennifer Galardi, Senior Policy Analyst at the Heritage Foundation. Hey, Jennifer, when did you become a Senior Policy Analyst? I didn't know they let women do that over there.
I know they're awfully open-minded at Heritage. They do allow women, and particularly people like me, in there about a month ago. So I'm just trying to get that ice machine, Jesse, on my counter.
Well,
just trying to
look,
make enough
stay
money
with
to
it.
get that ice machine and meet you, get to where you are.
Well, hang in there. Hang in there. You'll be there one day. All right. In all seriousness, look, I'm happy this is happening. I don't want to be Mr. Cynic like I always am. I should have never been on there to begin with. It is good. Good things are happening at the CDC and other health areas, right?
Yes, and like you said, don't be
Okay.
too cynical. It's a good start. I think it's
Yeah.
it's an opening to begin to have a conversation about the entire recommended vaccine schedule for kids, which me and my new colleagues at Heritage will be doing that. You have to be smart and incremental about these things. Remember that people have been bamboozled for so long with poor health information. So of course they're going to be skeptical and call you quacks when you start to question their firmly held, long-standing beliefs. And you'll always have those zealots, the burn it down types, who will never be satisfied with those incremental steps to policy change. But you know this better than anyone. The reality is the heavy hand of government can always be used by the other side that you don't like very much for horrendous, terrible policies. Take, for example, in the health movement, right? Imagine what the left could do to ban meat production in the name of environment or global warming. So we've already seen countries in Europe try to stifle farmers' production. And those in the Maha movement who understand how DC works are really thrilled about this. I can't remember a time when a vaccination or any health policy, frankly, has been rolled back, even when there's good data to support it. So it's a win.
Why is it never rolled back? That's an odd thing. Surely all of them aren't great, right? Or why do they never roll back? Does this just come down to money and the fact that the pharmaceutical companies have purchased our FDA long ago?
Yes, and also our politicians. I was listening to your snippet with Mike Benz and kind of lobbying for an increase in salary for some of our government, our representatives, because they actually don't get paid very much. And so offers to, stand up for big pharma can be very appealing to have that extra cash in their pocket. So money definitely has a lot to do with it. It's also the entrenched system. You've now got, I think the government represents 15% of employment in the country, 10 to 15%. You've got a lot of people employed by the government and a lot of people employed by so-called healthcare. I did a piece on this probably last year outlining the amount of money we spend on research for cancer. Where are you going to go with all these foundations, right? The Cancer Foundation, the Diabetes Association, all of these associations that get government grants. There's a lot of money. There is a lot of money in keeping people sick. We've heard that from Kennedy and Casey Means over and over again. But I think we are starting to just chip away. And I think we have to be optimistic about the potential.
A lot of this comes down to at least a lot of RFK's focus, and I know you're hot on this too, is childhood disease. It's wild. It's not just, old graying bald guys like me get sick out there and die. It's kids now. Kids are sick. Kids are fat. Kids are hugely fat in this country, just waddling around everywhere, and I don't understand what happened.
I think we've talked about this, I believe. There's a couple factors. Part of it is what they're eating. It's a huge part of it. This shift away from whole food diets to processed foods. I'm writing a piece right now on essentially, I'm not sure if you knew this, you probably did, you're very well educated on these things, but big tobacco essentially bought up a lot of the food companies like Kraft, Kellogg's, and they utilized the same addictive, let's say the same research that proved tobacco to be addictive. They kind of utilize those same techniques for food. So how do we make these food products more addictive to people? How do we make it less you're almost irresistible. I'm trying to not to find the right word, but these foods like irresistible, where you're actually never satiated, but you keep wanting more. And then they use the same marketing techniques to market this food to kids, which is where the food dyes came in, right? So you've got this system, the odds stacked against you, and then you just have a society that's become more and more comfortable, that doesn't move, that keeps kids in their seats, an education system that tells boys that they can't go roughhouse and play anymore, and tells girls that cooking and learning some domestic skills is sexist. So I mean, you start to pull the string on some of these things, and this cross cuts so many different aspects of our culture right now. And I just think we have to slowly start to inculcate kids with new education about food, get their hands dirty, get them active again. One of my biggest issues would just be get physical education back in schools, get those standards up.
Yeah, no, if you can't be humiliated in dodgeball, you're not actually in school. Jennifer, thank you so much. I appreciate you as always.
Thanks.
I would thank you for coming to my YouTube channel, but I know how brilliant it is, and I know you love it here. So subscribe and watch. We're going to start really ramping things up and putting some funny stuff, some interesting stuff out there, some collaborations. Either way, my YouTube channel is officially the place to be. So stick around.